Hello and welcome to the Transition Podcast. My name is Maral Agababai. I'm a Junior Policy Officer at the European Health Management Association, and I will be your host for this episode. The Transition Podcast is a 2-episode series exploring the digital transformation of oncology care financed by the EU for Health program. Transition examines how technological advancements are reshaping clinical decision-making, service management, and patient engagement, with a focus on equipping clinicians and health managers with the skills needed for effective data use. Through interviews with leading experts, we explore how training and policy can support the safe, ethical, and effective digital transformation of cancer care across Europe. Today's episode focuses on particularly critical aspects of this transformation: governance and ethical considerations in oncology digitalization, with a focus on the training gaps that still hinder the progress. To help us unpack this topic, I am joined by Dr. Zisis Kozlakidis, Head of Laboratory Services and Biobanking at the International Agency for Research on Cancer, part of the World Health Organization. A biologist by training, Dr. Zisis is a leading global expert in biobanking, health data governance, and digital infrastructure, particularly in the context of cancer research and care. With deep experience in bridging science, innovation, and real-world implementation, Dr. Zisis brings a unique perspective to the ethical and practical challenges of digital transformation in oncology. Dr. Zisis, thank you very much for joining us. It is a pleasure to have you here on the podcast.
Thank you very much for the introduction. Thank you very much for the invitation. I'm very happy to be here.
I'm very glad to hear that. Dr. Zisis, you have worked extensively on data governance and ethics in digital health, especially in oncology. Could you start by giving us an overview of your current work and how ethical and legal digital compliance features in the context of cancer care?
Yes, absolutely. And thank you for starting the discussion with this question. So my current work focuses on the intersection of data governance, ethics, and digital health, particularly within oncology. And what we see is that as cancer care becomes increasingly data-driven, we're seeing a growing reliance on the digital platforms, AI tools, large-scale data sharing to improve diagnostics, to do treatment personalization and drive patient outcomes. However, this transformation does raise significant ethical and legal challenges, and a core part of my work involves ensuring that digital health initiatives in oncology are not just technologically effective and technically effective, but also ethically sound and legally compliant. So this includes highlighting where we have robust governance frameworks for the responsible use of sensitive health data, for example, genomic and clinical information. I also work on consent models that are transparent, dynamic, and appropriate for longitudinal research. Very often in oncology, when we collect data, we want to do it for the same population over repeated intervals. And therefore, what you create now as terms as a governance foundation needs to be future-proof as much as possible. So in practice, this means working with multidisciplinary teams, with clinicians, researchers, data scientists, data policy officers, to identify the approaches that respect the patient autonomy, protect the privacy, and promote equity. So the ethical digital compliance for us isn't just a box-ticking exercise. It's a central tenet to building public trust and ensuring that innovations in cancer care will benefit all patients fairly and sustainably.
Thank you very much for your answer, Dr. Zisis. It's quite interesting because you have started a conversation with the ethical challenges that come with digital compliances. I'm wondering, is there a way for you to explain to us what the most common challenges or the most misunderstandings are that you've observed regarding data governance in legal frameworks?
Well, we have very frequently questions coming from the front line, so clinicians. They're quite happy with the technology, but unsure as to whether it's ethically compliant. because we're using sensitive data, and often we need to refer to different types of data, from images to genomic information. So being able to share this data across different teams is a question that is very frequently asked, for example.
I understand. With that being said, I'm wondering, from your experience, how would you assess the current level of digital literacy among the oncology healthcare professionals? As you have said before, that the clinicians are also asking for the use of digital health tools. So I'm wondering, from your experience, what is the digital literacy among these professionals, especially regarding the ethical consideration and then as well the legal compliances when it comes to managing the patient data?
From my experience, the level of digital literacy among oncology healthcare professionals is good and it's steadily improving. But the issue that we have is that it remains uneven. So, particularly when it comes to geographical regions, for example, resource restricted areas that are left behind this technological revolution. And the clinicians are generally aware of the importance of data protection and consent, especially given the sensitive nature of oncology data, because, as I said, it can include genomic, longitudinal, highly personal information. However, the rapid pace of digital transformation that ranges from AI tools to interoperable health records very often outpaces the availability of targeted training and institutional support. So, what do I mean? There is often a gap between the operational use of digital tools and a deeper understanding of the governance frameworks behind them. For example, many professionals may be using platforms that collect and share patient data without being fully aware of the legal implications under GDPR in Europe, the General Data Protection Regulation, or how to ensure patients' rights to access, withdraw, understand the use of their data, because the patient has a right to at least see the data. So the ethical literacy, which goes hand in hand with the digital literacy, is similarly very variable across the world. So we have some institutions that really embed it into practice with appropriate training, and others treat it as a compliance afterthought. It's not a priority, it's something we do to make sure that the clinical trial can move ahead. So bridging this gap requires ongoing investment in tailored training and, more important, practical guidance embedded in clinical workflows and the collaboration. So when digital literacy is enhanced with ethical and legal awareness, it does empower oncology professionals to engage more confidently in the data-driven innovation, while they're absolutely certain that the patient trust has been safeguarded. So if you want me to put it in a more provocative footing, let's say, one of the biggest gaps is that we still treat digital governance and ethics as a nice to have knowledge rather than as a clinical risk management essential. So if a surgeon doesn't know how to manage a scalpel, it's a liability, correct? Yet when a clinician mishandles patient data by accident or misinterprets an AI output or blindly trusts a digital system without questioning the assumptions, the consequences can be equally harmful, but they're invisible or less visible or less easy to track. And that's the gap that we're trying to address. And we really strongly believe that institutional training plays a key role in this.
Thank you very much. And thank you very much for pointing out the importance or the gap that actually exists that is between using the digital health tools, but also in understanding the legal implications as well as the GDPR. I specifically like what you said that ethical literacy goes hand in hand with digital literacy. So if you want to be high in digital literacy, you also need to be aware of the ethical and the legal compliances that lie underneath it. So thank you very much for pointing that out. Then, to my next question, given that the European Health Management Association is as well currently involved in upskilling initiatives for oncology professionals across Europe, we will be particularly interested in understanding how do you account for differences in infrastructure, regulatory requirements, and digital maturity when, let's say, designing or implementing training programs across diverse national healthcare systems.
Yes, that is an important point. When designing training programs for oncology professionals across diverse, say, European healthcare systems, it's essential to acknowledge and adapt to variations in infrastructure, regulatory landscapes, and the levels of digital maturity. To put it in simple terms, a one-size-fits-all approach simply just doesn't work in this context. We may have approaches that are good for at the regional level, so for two or three neighboring countries, or two or three countries at a similar socioeconomic background. But looking broader, we need to adapt. So our methodology starts with a contextual assessment. So we map the national and institutional capacities, the digital infrastructure, the regulatory environments, including the data protection laws, ethical oversight mechanisms, and the interoperability standards. And it is a lot, but there are assessment criteria for each one of these. So it's moving towards a very standardized type of contextual assessment. This helps us identify not only the technical starting points, but also the cultural and organizational readiness, if you like, for digital integration. One such example is our recently completed work in Armenia in collaboration with the Yerevan State Medical University, where we approached not just the protocols for cancer treatment and cancer diagnosis, but also the level of digital and ethical maturity and the governance frameworks that go behind it. It wasn't good enough to just update the protocols to ensure that they're going to be adapted to the local context and used. You had to provide advice and support for the other aspects as well. So we then adopt a modular and layered training design. So we have core principles such as data ethics, compliance, patient-centered consent, responsible AI use that are universally relevant. But we allow for customization through case studies, through different language and legal frameworks that resonate locally. It's very important to say, for example, when it comes to cancer, the agency did a study in sub-Saharan Africa, and linguistically, whether you're in the Francophone or Anglophone part of sub-Saharan Africa, your definition of cancer and the way you express is very different. So when you provide guidelines or you do training models, you have to adapt to those. In less digitally mature environments, we place greater emphasis on foundational digital skills and practical governance. In more advanced settings, we focus on advanced data integration, predictive analytics, and cross-border data sharing. So if you like, in the less advanced, we say, how do you set things up? In the more advanced, we know things have been set up, but what can we do with the setup that we have in place? For us, it's really important to involve the local stakeholders, so clinicians, data officers, legal experts, and ideally, patient representatives to ensure relevance and long-term adoption. So the goal is to create capacity building that is both locally grounded, but also aligned with European standards of quality and ethics in oncology care.
Thank you very much for the extensive explanation. I particularly like the fact that you also highlighted the fact that one approach can simply not fit into all healthcare settings. Adaptation is key. I agree with that. I also very much appreciated the example that you have given about the sub-Saharan Africa example of cultural readiness. how cancer is defined differently there. That also means that providing guidelines and training modules must be adapted, and that local stakeholder involvement is highly important if we want to ensure sustainable training as well as understanding of the ethical use. So, thank you very much for giving such a comprehensive answer. Continuing or based on the question that we have just discussed, I'm also wondering, based on the work, what are the main gaps that you have encountered that exist in trainings related specifically to data governance, privacy, and the ethical considerations when it comes to healthcare professional using specific digital health tools?
Um, in in my perspective, I would highlight three persistent gaps. Firstly, most training remains heavily compliance oriented. It focuses on what must be done to meet legal requirements rather than understanding why these requirements matter ethically or how to apply them or why they are there in the first place. Um, This can be achieved. We can just use real world clinical scenarios to drive forward this knowledge as to why these things are the way they are. And I understand this need to be heavily compliance oriented, but also the effect is that it limits the professional's ability to make informed value based decisions when they face ethical dilemmas. So, when you need to balance the patient autonomy with data driven recommendations, or when you need to balance the approval of secondary use for the data in research. So, that's really where this type of um, gap has the most significant effect. Secondly, there is often a lack of practical role specific training. For example, clinicians, data managers, IT staff, all these people will be involved in data workflows. Yet the training that we see rarely reflects anything beyond the distinct responsibilities and what we would say ethical touchpoints. So we grow professionally, speaking and being trained in silos, and we continue to implement training for new technologies in silos. So, in some way, we entrench the fragmentation in the system, and this is important for cancer care because really effective cancer care is multidisciplinary in its nature. Finally, a major gap is the underrepresentation of evolving challenges. So, when we talk about algorithmic bias or explainability in AI or digital exclusion for certain social groups, as new technologies emerge, the trainings need to include all these evolving challenges. It's not just a static regulation. Regulation is always slow. It always anticipates the technology to move forward, and then the regulation comes later on to draw the common denominator beyond which we shouldn't operate. But the training is not bound by this approach. It can be a more dynamic understanding of what is happening in practice and how data ethics is implemented. So to train and train again and retrain as technology advances is necessary, but only provided the training also moves with the times. Um, it's interesting because in oncology we do this for therapeutic options. There is constant training opportunities as technology advances, but when it comes to digital aspects, this is done much less frequently. One final thought, if I may, and this is my own reflection from traveling across different sites globally and meeting many of our colleagues. There is still a limited focus on fostering an interdisciplinary dialogue. Professionals need time and safe space to explore ethical questions, to share experiences, to co develop solutions. And this is something that moves beyond standard e learning modules. This is time that is not available currently because our systems work at full capacity. So, closing these gaps means that we need to integrate ethical literacy, legal awareness, and a practical application into the fabric of the professional development. as essential components of trustworthy digital healthcare. And this needs to happen as early as possible. So we need to have digital training, digital ethics training already at the university degree.
Thank you very much for that answer, Dr. Zisis. That actually is a very well bridge to my next question. You have talked about the lack of practical roles in training, as well as the underrepresentation of certain challenges or digital exclusion for certain social groups. That brings me to the next question. In light of all the challenges and the gaps that you've already described, as you said, there's a clear need for more structured or context-aware training. Given that the Transition Project, which seeks to enhance the digital literacy among oncology professionals, has also developed a series of training modules incorporating data sharing, cybersecurity, and ethical frameworks. In your view, you've already described this a bit before, but I'm wondering more specifically, in your view, how can such initiatives be institutionalized, be that through certification, integration into professional curricula, or even regulatory alignments, in order to practically contribute to a more standardized approach to quality and safety in oncology care, rather than just putting out there yet another training course?
This is such an important question. It's the million dollar question, isn't it? So one of the fundamental problems comes with the design of a lot of the courses that I see, and is that much of the current training assumes that healthcare professionals are just passive recipients of digital tools. In reality, oncology professionals are very active stewards of data-driven care. So training needs to teach professionals to not just stay compliant, but how to challenge the system, how uncomfortable questions can be asked and recognized when digital tools are introducing bias, when they're introducing exclusion or ethical shortcuts. The reality is that we've handed the keys of digital transformation to technologists and asked clinicians to quietly catch up. And that's usually backwards to what's normally happening in healthcare. Um, so until training reflects that urgency and shifts power back to the professionals and patients, I think we'll keep having these gaps. And I think that's why the transition project and this question are very timely, because for initiatives such as the transition project to move beyond isolated training efforts and genuinely enhance quality and safety in oncology care, institutionalization is the key. So it starts with embedding digital literacy, data governance, and ethics into the core professional curricula of oncology and related healthcare disciplines, but not as electives, as a mandatory competency that goes along the clinical knowledge. It's one thing to be very good clinicians, but we really need to interact in the digital space. So it's not an elective anymore. So certification may play a critical role in that direction, developing recognized accreditation pathways, which are ideally endorsed by professional bodies or academic institution. That adds legitimacy and motivates the uptake. When these certifications are aligned with the continuing professional development frameworks, so they become part of the lifelong learning rather than a one-off interventions, and allows people to come back and maybe do the same thing again once it's updated. Equally important is the regulatory alignment, because health authorities and medical boards can help institutionalize these efforts by linking digital and ethical competencies to licensing or service accreditation or funding mechanisms. So if a hospital or oncology unit must demonstrate staff proficiency in digital governance and cybersecurity, for example, and this is part of quality assurance, then training becomes a strategic asset rather than an optional add-on that you do because staff have requested this training to take place. Final thoughts, the initiatives such as the transition should always aim for integration with clinical systems and institutional workflows. So ensuring as much as possible that the training is applied in context. This may include simulated case studies or decision support tools or multidisciplinary ethics rounds, but it provides an apt evidence of the added value of the training. And I think it's a very useful proposition to a lot of the institutions. So by embedding the training into the professional, the regulatory, and the operational fabric of oncology care, we can create this shared baseline for digital literacy and ethics that will persist in time.
Thank you very much for the answer, and thank you very much again for such an elaborative answer. I agree with what you have said that the training becomes a strategic asset, especially in oncology, that initiatives such as transition also should always aim for an integration within the clinical context by embedding the initiative in our care. Well, actually, this is already done for today. Dr. Zisis, do you have anything else you would like to share with the audience before I close the podcast?
Just to say thank you very much, and to any of our colleagues, to invite them to investigate and engage with aspects of digital ethics, digital governance. This is something that is here to stay. And the earlier that we become familiar, the earlier that we become aware and start asking questions, the better it is for the service that we provide.
I agree. Well, thank you very much. I think that wraps up today's episode. Our sincere thanks go to Dr. Zisis Kozlakidis for sharing his experience on the ethical, legal, and governance challenges surrounding oncology digitalization. Your insights really illustrated the importance of context-specific training, the limitations of generic approaches, as well as the need to align digital innovation with regulatory as well as ethical safeguards. As mentioned before, the podcast was brought to you by Transition, a project financed by the EU for Health program. Thank you all for tuning in, and remember, digital progress means little without upskilling those who deliver the care. Thank you.